Good evening, everyone. Welcome to the Hemophilia Federation of America's Pride Project webinar series. Thank you for joining us this evening. My name is Ann-Grete Tan. I'm a bleeding disorders community member and a mom to a 16-year-old son with severe hemophilia A, who thankfully is doing very well. Before we get started, I'd like to go over a few helpful webinar tips. This evening's webinar will last approximately 1 hour and is being recorded for future playback. We welcome your participation and questions during the webinar. However, your audio will be muted during the entirety of the webinar, as this helps limit background noise that may disrupt the presentation. If you have a question, and we hope you will, please type it into the question box at the bottom of your control panel. We will address as many questions as we can at the end of the webinar, and if we run out of time, we will follow up by email. Tonight's webinar presentation is titled Pride Project: How do I participate in research as a community member? This educational webinar is the second in a 6-part series to train and engage bleeding disorder stakeholders on patient-centered outcome research and comparative effectiveness research. In this webinar, the focus is research participation for community members, such as patients and caregivers. Our presenter tonight is Julie Kennedy Lesch from the Patient-Centered Outcome Research Institute, known as PCORI, or PCORI for short, thank goodness. Julie is an engagement officer at PCORI, which means that she acts as a liaison between the engagement and science teams, helping to manage the organization's research portfolio and assuring engagement of patients and other stakeholders throughout the course of research projects. Before joining PCORI, Julie was the programs manager of a private foundation that supported the implementation of evidence-based asthma management programs to improve health outcomes for children and families living in medically underserved communities. I would also like to note that this webinar is funded through a PCORI Eugene Washington Engagement Award. So with that, I'm delighted to hand it over to Julie. Julie?
Thank you, Ann-Grete, and thank you to the Hemophilia Federation of America for inviting me to talk with you this evening about patient-centered outcomes research, or PCOR, as we like to call it, and comparative effectiveness research, or CER, and how you can get involved as a community member. So this is an overview of what I'll be covering this evening. As Ann-Grete also mentioned, this webinar is the second in a series of webinars. So through this series of webinars, the Hemophilia Federation of America is providing training and education to its members in patient-centered outcomes research. So if you missed the first webinar, please go back and take a look. It covers the basics of PCOR and CER, so it would be an important foundational piece to get you started. So this evening, I'm going to tell you a little bit more about PCORI. I'll talk about what we at PCORI mean by engagement and some of the pathways to engagement for community members. I'm going to also try to convince you that engaging in research is a win-win situation and let you know what engagement looks like on research projects, some of the common challenges that we've seen, as well as some additional training and resources, and also how the HFA can help you get engaged. So PCORI is an independent research institute. It was authorized by Congress in 2010. It's overseen by a 21-member board representing the entire healthcare community. It includes clinicians, patients, caregivers, researchers, the head of NIH, payers, pharmaceutical companies, and we fund comparative effectiveness research that engages patients and other stakeholders throughout the research process. We seek answers to real-world questions about what works best for patients based on their circumstances and concerns. So as I said earlier, the webinar that went before this one went into greater detail about CER and PCOR, but I think this image from Consumer Reports is a good way to think about the basic tenets of CER. So CER is comparing the effectiveness of 2 different treatments or interventions to learn what works best and for whom. PCOR, or patient-centered outcomes research, does this same exact thing, but it includes asking patients and other stakeholders what features or outcomes are most important to them and involving them throughout the research process. So if you were shopping for a large appliance like a washing machine, you would consult the best evidence in consumer reports to decide what type of washer would best fit your needs, right? So maybe if you live in an apartment, it would be important to you to have a stacked unit. If you have a big family, you would be looking for a unit with very large capacity, so on and so forth. The point here is that when patients are engaged in research from the very beginning, they are deciding what to study, what the research questions are, what comparisons need to be made, and also involved throughout the process so that they can inform investigators on what is important to them, the end user. So I think this is a helpful visual to give you a better sense of what we're talking about when we use terms like research engagement or engaged research. And I really want to underscore here that research engagement is an emerging concept in clinical research in this country, but it's certainly not something that PCORI invented or came upon de novo. There is a rich history of engagement in public health research and in health advocacy areas, like the ACT UP movement in the 1980s with AIDS and HIV research, and then in the 1990s with disability rights activists. They certainly contributed to changing the research norm to more of a shared model approach, and it introduced the concept of nothing about us without us. Patient and stakeholder engagement in clinical research is more established in countries like Canada and the UK, and we certainly draw from their resources when we think about the best ways to form these complicated partnerships. In fact, I believe patient advocacy groups like HFA are really a testament to the power of patients coming together to advocate and learn about their disease, their rights, and to support each other. So we want to support you in harnessing the power that you have together as a group. So what I would like for you to glean from this slide is that getting involved in PCOR is really moving you along this spectrum from a research subject to an engaged partner. And maybe for some of you all the way to conducting your own research and being the researcher. Ann-Grete shared with me that as a mom of a child with a bleeding disorder, her experience with research has really just been signing a form at a doctor's visit, allowing her child's information to be shared for research purposes, and then never hearing back about whether it made a difference. So this is probably a very common scenario for many of you. I know it certainly is for me. So what we're talking about and what PCORI is trying to do is change that culture, that one-sided transactional relationship of the medical community, taking something from you and not engaging you as the expert that you are. So this is really a win-win for everyone. Doing research in this way ensures that we're studying what really matters for patients, and then we know what patients and the medical we know that patients and the medical community will use the findings and will trust the findings, and hopefully the very end result of that continuum is that it will lead to better health. So from our PCORI vantage point as one of the main funders of this type of research, we see evidence of the impact of engagement on research questions, process design, and outcomes, certainly study participant experiences, on recruitment and retention in studies, on study quality, and also to whom and how the results are disseminated. So I'm going to talk with you more about what this looks like in the real world with some examples. So how do researchers or research centers, academic research centers, connect with patients to get their input, involvement, collaboration, and hopefully partnership? They tap into advocacy organizations like the HFA and others. They reach out to support groups and different community-based organizations like senior centers and churches, or sometimes there are existing advisory boards within academic medical centers or hospitals that they'll tap into. I also want to highlight here that this is oftentimes a bi-directional pattern. Organizations like the HFA and others can and have reached out to researchers for partnership opportunities. So it really goes both ways. Oftentimes on the individual level, the way an individual becomes involved in research is through their own clinical care, or because they've been involved in previous studies and had a positive experience, or sometimes there are relationships that bring them to involvement. So why engage? What's in it for you? I want to share with you a short excerpt from a patient and how she became involved in a research project. So this is from a manuscript from the journal Research Involvement and Engagement. It's an open access journal that's available on the internet. So this is her excerpt. Prior to the start of the project, we saw an announcement for an upcoming discussion on breast imaging in women after treatment for breast cancer. We participated in local focus group discussions about breast imaging, and we were subsequently asked to join the project as patient partners in the study. We initially thought our role would be as volunteers. We would give our opinions and have an opportunity to see firsthand how research is conducted. However, the principal investigator's vision was very different. In our first meeting, she asked us to be co-investigators, meaning we would have a say in all aspects of the study and be paid for our time. She sketched out how she envisioned the organizational structure, placing us in the center of all research activities. Our role was to listen carefully to all team members and represent the patient experience, not just our own, throughout all components of the project. At first, we felt unsure about how we would accomplish this work, how much time it would take, and if we were qualified. However, through our experience with a supportive team and clear patient inclusion, we have been able to demonstrate the value of patient voices in research discussions and made a successful collaboration. So, as you can probably guess, that's an excerpt from a PCORI study. And I can tell you the reasons why most people engage in research. And as our executive director, Joe Selby, has said very frequently, it's really not the patients who are the hardest to convince. Most often it's the clinicians, actually. But people generally get involved for a range of reasons. Some believe that it's their moral imperative to pay it forward so that someone who has their same disease will have a better experience based on what they have learned. Others say that they want to be connected. They want to know the researchers working on their condition and be able to benefit from the newest information as soon as possible. So for anyone who has a condition that affects their life on a daily basis or their loved one's life, I think you already know, and you already have a sense of urgency to make things better. You know, seeing that it takes 17 years for research to actually make it into the field of practice in medicine, researchers urgently need your input to understand outcomes that are most important to you, the multitude of treatment and therapeutic options, what works best and for whom, and also the unique challenges that the hemophilia community faces. So if patients, caregivers, and stakeholders are involved at the front end in the process, perhaps it won't take 17 years to actually reap the benefits. So you are an expert on being you and living with this disease. The comments that I hear most often from patient and stakeholder partners is that they don't have any important information that a researcher would need. They sort of take the stance of, what would I add to a research project? So know that you see things from a different perspective, and this is extremely valuable to the research enterprise. No contribution or observation is minor, and what you think might be common sense may not always be well known or practiced in the research or medical community. One of my favorite quotes from one of our projects is from a patient saying, "Sometimes I'll say something and Tracy, who's the researcher, will say, 'That's a very important point.' And I'm like, 'It was?'" So you never know. Harnessing the value will allow you, the value of your lived experience will allow you to advise and work with researchers so that they can make research more meaningful. And somewhere along down the line, you may actually get to a place where you don't need the researcher and you become the researcher. So these are some findings from our portfolio of what the most common effects of engagement has been on patient partners. So we see that they establish new relationships, they have improved personal health management, they made a difference in the lives of others, they have personal growth or self-improvement, gain new knowledge and insights about research. I've often seen new professional opportunities. A patient will be involved in a study at an academic medical center and will actually become an employee of the organization. And certainly patient partners leave the study with a belief in the true value of patient and stakeholder representation in research. So on establishing new relationships, this patient said, "Our patient and family panel has become a family. We care about each other and what each and every one is going through." On improved personal health management, understanding the various health disparities leading to diabetes and kidney disease has made me assess my personal life, my level of physical activity, and my food intake. I have made changes in my lifestyle, which include exercising 3 times per week and encouraging my family to take part in physical activities such as hiking, basketball, and so forth. This was an eye-opener. Also on improved personal health management, patients I've been working with have taught me to be a better patient, to self-advocate. Again, the power of coming together. On making a difference in the lives of others. As an older citizen with mobility limitations, this involvement has allowed me to contribute to the better good. Although I have personal medical issues and challenges, doing what I can in my very limited capacity to improving opportunities for broader patient involvement in healthcare decision-making and the shaping of healthcare to reflect patient needs. So now I'm going to talk a little bit about what partnering and research looks like as a community member. So when we talk about research and research projects, we generally look at it in 3 phases: planning the study, conducting the study, and disseminating the results. Types of language should the study team use to appeal to the patient population involved? So this is an example of a PCORI-funded study. So the study cited here is comparing a traditional referral system for socioeconomically disadvantaged women who come to their OBGYN with behavioral health concerns to an enhanced screening and referral intervention. So it involves a community advisory board and several other stakeholders, as you can see. So if you look at it this way, one group of patients will be matched with a peer navigator who is from their neighborhood and who has gone through some of the very same issues they're experiencing, and will help them work through these issues over a 4-month period. And then the other group will be given a list of referral sources of where they can follow up to get their behavioral health care needs addressed. So you can see on this slide how the very specific recommendations made by the stakeholders in the planning phase of the study had some very specific impacts on the outcomes being measured and the design of the study. During the conduct phase of a study, patient partners can have a huge impact on assisting with recruitment of participants into the study, with data collection in some instances, with ways to adjust the study and to revise the materials to make them easier to understand. This example is a study that was conducted at Nationwide Children's Hospital in Ohio. So in this study, children and families are choosing between surgery for appendicitis or treatment with antibiotics alone. And investigators are testing whether a shared decision-making tool that they use during the consultation process will have an effect on important outcomes like quality of life. So you can see on the left of this slide that they had a 20-member multidisciplinary stakeholder group that included children and their families, healthcare professionals, payers, patient educators. And then as you can see here, after they implemented their stakeholders' recommendations, they were able to see a significant improvement in enrollment and retention. I think this is a great example because it's two very small, very doable stakeholder recommendations to change the enrollment script and to offer an online option to complete the follow-up questionnaire. And these two very small changes made a quantifiable difference in their enrollment and retention in this study. So the last phase of the project is, of course, the dissemination phase. This is my favorite phase. There's so many ways for patient partners to be involved here, and really dissemination planning should start from the beginning, and it should be baked into the project from the very beginning. Some additional ways that patients and stakeholders can help with dissemination include co-authoring manuscripts, sort of like the one I highlighted earlier, attending conferences together, doing media interviews, spreading the word online through social media, and even through your own actual in-person networks. So two illustrative quotes here. The first one says, advisors provided concrete suggestions about how to visually present study data to lay audiences in terms of format, layout, and content. The other one says, patients and other stakeholders have communicated with other patients and national organizations, sharing information about the project, and have brought ideas and opinions to the table that have impacted some of the decisions we have made. So as we know, with any kind of culture change, it's not always easy and doesn't always go according to plan. So here you can see some of the common challenges that patient and stakeholder partners encounter while on a study, as well as some of the challenges that researchers face. So partners cite things like project delays, managing different perspectives, sometimes difficulty understanding research jargon, and then researchers or awardees cite difficulty in identifying and inviting partners, or difficulty identifying and fully including diverse partners. And they're certainly understanding and realizing that engaged research does take additional time and effort. Awardees and partners agreed that scheduling logistics were certainly a challenge, as well as sometimes inconsistent participation, which can happen when you're working with people with serious health conditions. So some of the solutions that were recommended by partners include setting clear expectations, training partners, using plain language at meetings, and creating a supportive, respectful environment. One of the quotes here, having the roundtable discussions where every person's ideas were valued equally was really important. It made it so that everyone was more willing to share honestly because they weren't intimidated or made to feel that the doctors or researchers knew better than we as parents, caregivers did. So creating that safe space. So PCORI and many others have developed tools and resources to help research teams work best together. PCORI has authored some publications on engagement and our lessons learned, some of which are featured here, but also available on our website. PCORI has also developed something called the engagement rubric. It's really a tool to guide researchers and others on how to incorporate effective engagement practices in all phases of a research project. So going over the phases that I just discussed. The rubric has actual examples from PCORI studies showing the implementation of engagement in the 3 phases of the research project. And it also highlights the principles of engagement: reciprocal relationships, co-learning, partnership, trust, transparency, and honesty. These are some additional resources that you may find useful. The Community Campus Partnerships for Health website has a great list of resources to help with doing engaged research. The 2 training resources listed here are for patient partners, and those are links right to the curricula. And finally, the Inspire repository initiative to support patient involvement in research is a really comprehensive repository of all kinds of different tools and resources to help facilitate engaged research. So now I believe I'm going to turn it over to Elaine Chan, who's the program manager at HFA and the senior research analyst, and she is going to discuss how you can take the next step and get involved through these avenues at HFA.
Thank you, Julie, and good evening, everyone. So I just want to provide some opportunities currently that HFA has for community members to get involved in the research process. First, for HFA, research is completely community-driven, and your voice deserves to be heard. So this survey that we have is what is called the "What is your research question?" is on our website. This brief survey provides you with an opportunity to tell us what and where to focus our research efforts. It was the results from this initial survey from last year that led us to apply for a PCORI Engagement Award, so we can provide you with the trainings on the concepts of patient-centered outcomes research and comparative effectiveness research. So we are continuously collecting questions and also any kind of research topic that may be important to people within our community. And then next, we also have the HFA Community Research Portal. The portal is a safe and secure platform HFA used to collect data for research on the bleeding disorder community to more effectively serve the needs of bleeding disorder patients and their families. In the near future, the portal will be launching several longitudinal studies where the findings can yield tremendous insights to the needs of this community. So don't hesitate to learn a little bit more about what the portal is by going to our website, and also participate by signing up. And be on the lookout of some of these launches of these surveys, and then participate and engage by using the skills that or the concepts that Julie had mentioned in this webinar. And of course, lastly, contact us, the research team, directly. Please contact us to discuss your interests. We welcome your questions and feedback so our work can continue to evolve and reflect your interests and your needs. We will continue to build and gather opportunities so that you can use the skills from these trainings to become engaging research partners. We're constantly changing. There's things that are coming up that involve everyone in this community. So please don't hesitate to reach out to us. Our email is research@hemophiliafed.org. You can also call us directly to our office and speak to one of our staff members, and we will definitely have a conversation with you in terms of what your interest is, your research interest, and also any concerns that you may have in participating in research. So with that in mind, I will turn this presentation back to our moderator, Ann-Grete, for any question that comes up for you from this presentation.
Great, thank you, Elaine. And Julie, thank you so much for the presentation and for all that helpful and useful information. It was really great. So for everyone who's attending, the webinar recording and the slides will be available for download on the HFA website. So please look out for an email tomorrow with the links and information in case you want to watch it again. And now we're going to open it up for questions. So your line will remain muted, but if you look at the question box at the bottom of your control panel, which I think is on the right of your screen, you can type in any questions you have. And remember, there are no dumb questions. If you do that, I will read them off to our panel of speakers. So, so let's see, what do we have so far? All right, so here's a question. How much would a patient expect to be paid to participate in research as described in the webinar?
So that's a great question, and one that we get often. PCORI doesn't take a firm stance on certain dollar amounts for certain hours. We provide something called a compensation framework, and that's available on our website in the engagement section. Actually, I can send the direct link to it to Elaine to distribute with the recording, with the slides from the webinar. But that provides guidance on what types of roles patient partners can have on a research project and the varying compensation levels based on how heavily involved you are. So it can sort of provide a guide for you to be able to talk to your research partner and work that out.
Okay, great. Thank you. And here's another one. When I participate in research, I always wonder how long it takes before change takes effect. Can you talk more about this? How will I know when my participation, I guess, actually makes a difference?
Yeah, I think that can be the most frustrating part about research, is that it doesn't move quickly. But one of the exciting things about PCORI and our mandate, besides it being patient-centered and us having the authorization and the mandate to involve patients and stakeholders in the design of the research, the formulation of the research question, the conduct of the study, we also have the mandate to communicate the results back to the participants and the patient partners who were involved in the study. So all PCORI projects, all research funded by PCORI, the results will be posted on our website. And that's pretty novel for clinical research. Oftentimes the only way you get to see the results is to look to the medical literature. And sometimes if the results were not what the researchers thought they would be, they don't publish on those particular results. So that was one of the key aspects of PCORI, that any research funded by us would be made publicly available on our website. And we certainly have it within our contract with research organizations that when they are done with the study, they have an obligation to go back to the participants and give them the results. And that can be through an email directing them to the PCORI website where their research summary is located. It can be through an in-person meeting. It could be through a letter in the mail, but it has to happen. That's one of our requirements.
Okay, great. Thank you. So here's another one. They're coming in fast and furious. PCORI seems to have a large research focus. What type of projects have PCORI funded which focus on rare or genetic diseases?
Yeah, so PCORI has over 500 projects now in its portfolio. And actually, our website is the best resource for answering that question. We have a very detailed section called Research and Results, and you can actually click on that section and you can search our portfolio of funded research. You can explore by geographical area and by condition, and they're actually one of the condition areas is rare diseases. So you can select that option and explore the portfolio of projects within that area. I do know that one of the more recent targeted funding announcements that PCORI puts in its rare disease bucket has been on sickle cell disease and transition from adult or pediatric care to adult care.
Okay, it sounds like there's quite a lot on the website then that we can look into if we have more questions. Yeah, so I think this might be the last one unless another one comes in. It's just the one more here. How am I supposed to participate as a research partner when I have a full-time job and children to take care of?
Yeah, so that's also a great question, and I think that's really why one of the main challenges that we see is the scheduling, logistical challenges that patient partners and researchers have. Most projects that I've seen at PCORI go to great lengths to schedule meetings when patient partners are available. So there are a lot of evening meetings. We ask that researchers include not only compensation for patient partners in their studies, but to think about things like how a patient is going to get to the meeting location. Some researchers incorporate childcare costs into their budgets so that if you, for instance, if it's a study on postpartum depression, and you're a patient partner involved in the study and you go to a meeting, you need to have child care there to participate. I mean, I really want to emphasize that we see patient partners as skilled experts. You're not a human subject. You are a technical expert, and we expect you to be compensated as such and for that to be included in the budget of the PCORI project.
Yeah, great. Thank you, Julie. So I think we're out of questions, but just to finish up. So once again, Julie, thank you so much for your time and for your insightful presentation, and thank you everyone to the audience for attending this evening. So as a reminder, this webinar is being recorded and will be available shortly on HFA's website via the resource library and also on our YouTube channel. And really, really important, if you have any questions, please contact research@hemophiliafed.org or simply reply to the webinar confirmation email we received. And, we really welcome your questions. If you have questions for Julie, we will forward them on to her as well. And we also ask you to please complete the short evaluation that will pop up on your screen once this webinar concludes. So thank you again, everyone, and have a wonderful, wonderful evening. Oh, and there's Julie's email right there on the screen. So with that, thank you very much and have a wonderful evening. Good night.